Bronx Sickle Cell Anemia Hemoglobinopathy Network and unites Bronx Lebanon Hospital and other community partners, including Sickle Cell Thalassemia patients, African Services Community, and several health centers such as Morris Heights and Urban Health Plan, in order to develop a community infrastructure for better sickle cell anemia medical and social services. They'll develop support groups for parents as well as young people in sickle cell in their transition to adulthood. Also, this Friday, they'll be hosting their first forum of the year at Lincoln Hospital. Here to tell us more are Mark Goodwin and Halima Hayward, and we thank you both for coming and sharing with us today.
Good morning, Darren. It's good to be here.
Good to have you.
I'm a social worker. I'm program coordinator of the sickle cell program at Bronx Lebanon, and I'm working with Dr. Thomas Moulton, who has a 4-year federal grant to build up this program in the Bronx. So we're working with the care coordination and the management. We have the newborn screening. As you may know, New York and all the states now have newborn screening for sickle cell and other blood disorders or disorders. So we get, for the babies born at Bronx Lebanon, we get that follow-up. They come into our sickle cell or hematology clinic. So hematology is the study of the blood, and there's sickle cell, thalassemia, trait, and some other iron deficiencies, different types of anemias that we do see. So we're building that up. We want to counsel parents of young children, also the teenagers, the adolescents as they become adults. We want to work with them on a transition to help prepare them for the adult world in general and also to manage a chronic health condition.
Halima, you talk about sickle cells. Sickle cells are numbers on the rise, and for people who may not be so familiar with sickle cell, why don't we share a little bit about that too?
Sickle cell is a disease of the red blood cells. The cells are shaped like sickles. Why they call it sickle cell, they have a problem carrying oxygen, and they get caught in the blood vessels, and it's like a roadblock. And they prevent oxygen from getting to the area, and the area swells, inflammation, and it causes pain. It can cause organ damage, bone damage, strokes. There's a long list of complications that come along with sickle cell disease. But now with modern medicine, there's expanding the lifespan of people with sickle cell disease, and there's a lot of treatments out there, so people are doing better.
Talk about Friday, because Friday is a very important day for you guys as well.
Yes, this Friday we're having our first community forum. It will be held at Lincoln Hospital this Friday, January 13th, 2 to 6 p.m. And the focus is not just sickle cell, but it's various chronic disease conditions, health conditions in the community. So we're looking for a general audience in the community to look at asthma, diabetes, high blood pressure, as well as sickle cell anemia and trait. We have a lot of immigrants in the Bronx from the Caribbean or Africa that may not know their status until they have a child with sickle cell trait or sickle cell disease. So we want to start reaching out to the immigrant community especially, and build the networks with African Services Committee, local places of worship, churches, mosques. We're looking for different venues for future forums in the spring and summer.
So Friday from 2 to 6 at Lincoln Hospital will be the day and time?
Yes.
Okay.
And we also have a published poet, Daryl Allardyce, coming from Brooklyn. He's a gentleman living with sickle cell, and he's published a book of poetry called Jaundice about his life experiences, and he'll be there to do a poetry reading.
Wow, some pretty interesting stuff. What do people need to know in terms of, some of the misinformation that's out there? There's a lot of misinformation out there, and sometimes people just don't have the necessary tools they need.
Yeah. Well, there's a lot of misinformation about sickle cell disease. One is that it's contagious, which is not. 2 is that it's a type of cancer, which is not. 3 is that you don't live past a certain age, which used to be true, but is not true anymore because of modern medicine and treatments. So we would like to get the word out of what sickle cell really is, how it's passed on, for people to get tested for the trait, because the trait is half, you would say, of the gene, and then there's another half of the gene, and when people mate and the child gets both genes, then they have a child with the disease. So we would like to keep, the numbers of newborns being born with sickle cell disease down. So if people know their trait status and they don't mate with someone who has the trait, then we can kind of keep the numbers, you know, down. I mean, you can't help who you fall in love with, but, you know, information is key.
That's right. I want to tell you, Bronx Lebanon is doing some great things as well too. So you guys have a grant, and you'll be doing some work in terms of research. Is also, you know, making
Yes. We do want to kind of test people's knowledge of managing their own disease, and really to reach out to the multicultural dimension. Sickle cell trait developed actually as a natural defense against malaria throughout regions of the globe, Europe, Africa, and Asia. So we actually have people in the Bronx who are Italian or Greek, African, Dominican, Caribbean, Indian, Bangladeshi, Vietnamese that would be affected by the sickle cell trait.
Well, we want to thank you guys for coming and sharing. So it's Friday, 2 to 6,
Yes.
Lincoln
Yes.
Hospital. So we're encouraging people to come on out and be a part of that. Friday between 2 to 6 at Lincoln Hospital. You'll be able to find out more information in regards to sickle cell. As you said, you also have a poet on hand who'll be reading some poetry and then get the much needed information. So thank you both for coming and sharing with us here on Open.
Thank you.
Thank you.
All right.